Welcome to Penrose Learning, where we make understanding easy.
You start by arranging an oculoplastic evaluation and getting objective data. This is not cosmetic guesswork. Once booked, take standardized photos and obtain orbital imaging so the surgeon can quantify bone, muscle, and soft tissue asymmetry. Make sure to record eyelid height, palpebral fissure, and brow position. Those measurements guide treatment choice. After imaging, the surgeon explains options. Surgery is commonly the only definitive fix for structural asymmetry, so prepare questions about risks, goals, and recovery timeline. Next, you move into detailed planning with your surgeon and team. They choose a tailored approach, eyelid lift, muscle adjustment, or orbital correction, based on the imaging and measurements. This is why precise data matters. Once the plan is set, complete pre-op labs and anesthesia clearance, and follow medication instructions closely. On the day, the surgeon marks landmarks and uses intraoperative measurements and temporary sutures to test symmetry before final closure. These deliberate steps reduce revision risk and optimize balance. Finish by committing to postoperative care and follow-up. Healing dictates final results. You will use cold compresses early, keep your head elevated, take antibiotics or analgesics as directed, and avoid strenuous activity. These steps limit swelling and scarring. Make sure to attend scheduled checks so the surgeon can monitor symmetry as tissues settle. If you still have asymmetry after about 3 months, discuss revision options. The key troubleshooting tip is timely reassessment to plan controlled, minor corrections rather than waiting indefinitely.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.